If you have a posterior tilted pelvis, what that means is you have a tendency to tuck your butt underneath and drive your hips forward. And chances are you not only stand like this, but you walk from that position. The problem with that is that it creates a whole bunch of dysfunction around your hip, sacroiliac joint, and low back. So the problem is that when you go to take a step, if you've got your pelvis tucked underneath, you have a hard time getting this leg behind you and getting proper stride. The other thing that happens with this is you will have a tendency to activate all these muscles in the front, your hip flexor like the psoas, muscles through the front of the leg, as opposed to activating the posterior chain, which is your calf, hamstrings, and glute, that tends to really help you to propel forward and walk correctly, keep your hip joint and everything in the low back nice and healthy. So I'm going to teach you an easy exercise that you can learn. You can do it in 30 seconds to a minute, and it can help correct this problem. So let's get started. I'm going to turn to the side so you can see what I'm doing. I'm going to take a small step forward, not a deep lunge or anything like that, just a normal step like in my gait. And I want to have both my feet pointed straight ahead and my hips pointed straight ahead for this. Now, in this position, you probably have a tendency to drive your hips forward like this, which is putting a lot of strain through here, not allowing you to get your leg far enough back so that you can push off it and propel yourself forward. So what we're going to do to fix that is I'm going to first have you put your hands right here on your sternum, and we're going to just move the pelvis. I don't want anything in through the sternum, in through the rib cage to be pushing forward. What you're going to do is you're going to gently practice just tipping your pelvis forward. And this is easily, or most easily done by trying to push your butt out behind you so you feel a little curve in your back. The reason for the hands here is that there's a lot of tendency with people that are stuck like that with a posterior tilt to push forward from the sternum, as you can see here, and think that they're arching their back, but they're doing all the arching in the middle back, not the low back. So hold the hands here, get a little bit of a push, and this is not a huge movement. It's not like clunking. It's just a little bit of a tip. All right, so once you get that forward tip going, you'll start to feel a little bit of a stretch in through the hip flexors here. Now, the next thing you're going to add to that is you're going to drive your heel, push with pressure through your heel into the floor as if you're trying to push through the floor. And the reason for this is that it helps to get you into that extension, and it further stretches out the muscles and connective tissue through here. Once you're in that position, what I'm now going to have you do is put your hand on your butt, and you're going to squeeze that glute. And this is going to take some concentration because you may not be used to firing this correctly. So you're going to squeeze it till you feel it firm up in your hand, and you're going to hold it like that. Now the last part of this, we've got a few things going on, right? We've got the forward tilt, or the anterior tilt of the pelvis, with a little arch in the low back, the heel pushing into the floor, and the squeezing of the glute. The last thing we're going to add is lifting the rib cage up, as if you're imagining a string pulling up on the top of your head, or you trying to reach your head toward the ceiling. And you're just going to hold that position with a nice long spine, glute firing, heel pushing through the floor, and you're going to hold that for 30 seconds to a minute. And what this will do over time is it'll start to teach your nervous system and your joints and all the receptors around there that have gotten used to it being locked up, that they can open back up and you can get proper extension, or what we call hip extension, so that you can push off correctly and avoid a lot of the problems that you're going to have down the line with this kind of problem.